Okay, we're live. Hi, everybody. Welcome to Wellness Wednesdays with me, Yehuda Shamroth. I've been a nurse anesthetist for over 30 years in the United States, and I am currently a practitioner of traditional Chinese medicine, acupuncture, herbology, and health coaching. And in these parts, in Jerusalem area, Ramat Beit Shemesh, now I live in Israel for several years, I'm known as the nurse that does acupuncture. Please feel free to watch these videos, these live presentations here on Facebook and on YouTube. I have a YouTube channel. You can access all the previous Wellness Wednesday webinars. Please give it a thumbs up because the more likes and thumbs up that I get, the more I can improve the webinars. And please feel free to post comments and request the topics related to health, nutrition, and wellness that you would like to hear about in the future. Today, I have a very special guest. I'm going to bring her on in a little bit because today's topic is chronic pain. Understanding it from a mind-body connection with special guest Chana Studley. She'll be on very soon. She is the Principles Practitioner and author of a few novels on pain, and I'll give her a more complete bio in just a bit. Continuing with our weekly webinar, Health and Wellness, I always like to give a COVID update, and I'm going to share the screen on my slides now, because it's important to do the same thing every week, but with a little bit different twist. Okay, so these are the recommended supplements, okay? Remember, every week we say that they've been coming up with studies all over the place that in order to really fight this illness and to fight this virus and fight it while you have it and before you have it, it's very important to keep up these important vitamins. Vitamin C, vitamin D3, zinc, quercetin, melatonin, and probiotics. Okay, we've been through these many times, but it is interesting to me that we get all types of medical tests to evaluate everything from blood pressure to cholesterol, and yet we don't have anything to really evaluate our vitamin levels to that great degree. I think a lot of other doctors and other people agree with me that you could consider to blood tests to check your vitamin levels individually, but maybe they should come up with just a panel for this now so we could do it easily and more or less more cost effective. So I think it's one of the most smartest things that a person can do right now, because it's such an unpredictable illness. I have friends and colleagues and patients who are experiencing having COVID with all kinds of different symptoms, everything from respiratory, God forbid, in the hospital, to tremendous headaches. I had that myself, but they resolved. But I have a patient right now who has headaches going on 5 weeks after the illness has ended, and she's miserable, and we're trying to help her now. Only on the second treatment, she's being helped a bit, but we need more time. But she's taking her vitamins on and off, and I think it's very important that, it sounds crazy, but because vitamins, we used to laugh at them in the medical community, not me, but before we got more interested in doing research on nutrition, especially nutritional value of foods and food as medicine. Doctors never thought the vitamins really did very much good for you, but now they're turning the corner and they're really singing a different tune, particularly vitamin D. A new study has come out and a new analysis has come out to know what we know about vitamin D and COVID. And we know that vitamin D, the people who get COVID have a greater tendency, who don't have a good vitamin D level, have a greater tendency for becoming very, very sick. When a person's on a ventilator, it's terrible. The outcomes are never good. And you always have a residual, very, very weak lungs, if not more. So we can keep people off the ventilators with just simply taking vitamin D. And as you see on my slide here, vitamin D, if you're trying to use a preventative dose, 1,000 to 4,000 international units a day, and 8,000 units a day if you're actively experiencing COVID right now. And so, of course, you want to support your immune system with good nutrition, good sleep, good food, everything else we talked about in every single group. I don't want to spend a lot of time on this. I do this every week, but I just feel like the vitamin D levels are, we know they go down automatically in the wintertime, and here we are in the winter anyway. You need about 20 minutes of sunlight to get proper vitamin D. There was a study done of very, very religious children, Jewish religious children in New York one year. All these children were coming down with rickets. Rickets is a vitamin D deficiency. These kids tended to wear long sleeves covering their arms and collars up to their necks and pants. And they wear this all day, every day, and little hats on their heads. Or the boys wear the yarmulkes, and the girls don't cover their hair normally. But we do know the kids are very covered up compared to most kids. And they found that every one of these kids had a vitamin D deficiency, and it was very easily correctable. So anyway, lots of doctors are coming out and saying, take your vitamin D, okay? Get your levels up. And you can get a blood test if you're trying to check. And again, I think I've mentioned before, I have never heard a doctor say, and in fact, they discussed this, that there is no such thing really as a vitamin D overdose. You really can't overdo it like you can with other things. If you take too much vitamin C, for instance, it's a very cold medication, and it can cool you down, and you can become much more sick if you overdose on vitamin C. It cools down your whole body, and you don't even realize it. But you could be more apt to be open to infection. And here we think vitamin C is the one, but it's really vitamin D what we need. So just we know it works well. It's known to show good benefits and outcome to all illnesses. We want to take our zinc. It stops the viral replication in multiple ways, and it prevents the virus from hijacking your DNA. Okay, and so that when it goes in the DNA, it just replicates and replicates, and that's how you keep getting sicker and passing it on. So zinc is very, very important right now. Something called quercetin, which is called a natural bioflavonoid. We have it in our foods. Like we went through many times, a slide shows the foods that you eat for COVID, which we don't want to do today because we want to get to our guest. But quercetin opens up the cells in your body so that the zinc can get inside where it works and repairs. So think of them working together, and we know that we can eat a lot of good foods for vitamin D, like cod liver oil, fatty fish, and mushrooms are great. All mushrooms of every kind are fantastic. They're anti-inflammatory and immune building. And also the quercetin, vitamin C, are all the citrus fruits. And the quercetin is, you can find it in all red vegetables. If you're able to eat red peppers, if you're able to eat tomatoes, if you're able to eat cherries, if you're able to eat anything red, anything with a red color, that's full of quercetin. So, and the probiotics, melatonin, they say has some anti-inflammatory effect nowadays. And also the probiotics, we can't emphasize enough how probiotics will improve your digestion. And if you don't improve your digestion, first of all, we know the immune system is pretty much largely found in the small intestine. So keep that very healthy. Probiotics will help restore the good bacteria and get rid of the bad. And it keeps your digestion just flowing well. Okay, let's talk about chronic pain. This is what we're here for today. Okay. Unfortunately, so many people suffer from chronic pain and all kinds of pains. Everything from fibromyalgia pain to, pains from injuries, emotional, psychosocial pain, all kinds of pains. It's very, very bad. It's most unwelcome. It's a very intrusive experience that we have. And even the memory can steal you from the present moment. Your memory of like when that pain was so bad. The only pain that I think is really, people seem to not complain about too much is the pain of childbirth. Some people say, yes, it was horrible. Obviously, I had epidurals because I was an anesthetist, so I was very pro epidural. It doesn't mean I'm a baby, and it doesn't mean it wasn't natural. That's just another topic. I needed that, and I did that for thousands of women. I did epidural, so I was very proud of helping people have happy, pain-free deliveries. But the truth is, even people who didn't use epidurals, they don't remember the pain. Some pains just disappear, and we just bury them in the recesses of our mind, especially if there's a good event at the end, like a baby. But we do know that the brain processes the pain in all different ways for all different people. And our perception is different according to every individual and how it feels. And it's affected by a number of things, like what's happening now in your life, what our previous experiences of it were, what our beliefs and expectations about pain. Some people are not allowed to express that they're in pain because their families don't allow for it. It's a cultural thing. Most of the time, we do think of pain as a symptom of a disease, and almost all the time it is true. But for some people, pain is the disease itself, and we'll talk more about that. And we know that pains can come from tumors, infections, injury, chronic inflammation, emotional trauma, all kinds of different causes of pain. But we do have a role of pain on our body in general. Even though pain is uncomfortable, it is a protective mechanism that alerts us to the potential or the hopefully more pain coming our way into the body's tissues. So let's say a bee stings you, okay, and on your nose, let's say it stings you right here. So the peripheral nervous system sends a pain message through the spinal cord to the brain that you just got stung. And the communication works very quickly, and you just put your hand up there to stop the pain, and you try to protect yourself from further injury. And so the pain receptors in the skin, they detect this tissue damage from the sting, and the nerve sends pain signals to the brain, and the brain analyzes it, and in turn, it sends a delivery back to the muscles in the arm, and then you're reacting. So as you can tell, it's a very effective system when it comes to acute pain. And then along the lines of acute pain, people like to distinguish different types of pain. There's many, many ways to distinguish types of pain, but in general, it falls into two categories: acute pain and chronic pain. So let me just turn my slides. I forgot I don't have a slide projection person. We know there's a lot of causes of pain. This is a very funny poster. I thought it must have been an old one, but these are the 10 top causes of pain: poor posture, traumatic injury, lifting and carrying heavy objects. And look at this down there, high heels. I stopped wearing them 20 years ago, so I never had a problem wearing. I mean, I did. It caused me pain, nerve damage, poor sleep and poor sleeping habits, and poor, sleeping on a poor mattress, and all kinds of diseases. So this is a pretty accurate, but it just is a very, very general. So talking about the difference between acute and chronic pain. So there are different types of pain. Obviously, an acute is the type of pain that is typically lasts less than 3 to 6 months, and is a pain that is directly related to soft tissue damage a lot of times, or even a surgical procedure, or some kind of you can have pain and you can have headaches from sinus blockages. There's all kinds of acute pain situations that happen, but it is usually the shorter duration pain, and it can resolve itself as the injured tissues heal. And it is distinct from chronic pain because it usually is much more sharp and severe, although you can have sharp chronic pain as well. But it's usually short duration, and usually you just treat the underlying cause. And the chronic pain, we're going to spend much more time on, and just a few minutes anyway. And you don't always know the cause of it. It goes for longer than 3 months. And that's the doctors, when you go to your physician and say, I've had this pain for over 3 months, they're going to call it chronic pain right away. You just fall right into that category. This is not a clear slide, but inflammation, we had a whole session on this. Inflammation causes all kinds of pain in everywhere in the body. And if we eat in an anti-inflammatory way and take all those beautiful vitamins we talked about, the inflammation will go down, because inflammation causes joint pain, abnormal growth of healthy cells, digestive problems like irritable bowel syndrome, memory loss. It affects the brain. It can cause skin aging and wrinkles. And of course, I'm trying to fight that, and loss of muscle tone, and all kinds of problems with inflammation. So we want to work on fighting our inflammation by eating anti-inflammatory foods, no sugar, no processed foods, all that stuff. So I don't want to spend a lot of time on how pain works in the body, but signals that, obviously, what we said before, you have a pain in a certain area and it goes to the spinal cord and it shoots a message to the brain instantaneously. There are neurotransmitters, there are nociceptors. They travel back and forth. These are the pain receptors, and they break down even further to C fibers and A fibers and B fibers. C fibers are the pain fibers that I would try to focus on when I was giving local anesthesia. We would try to deaden up the C fibers because they were the most active. But chronic pain, it's sometimes a little more confusing than this. It doesn't always come in the form of something you can point your finger at and say, here's what the cause is. Okay, I'm sorry, I'm trying to find my cursor here. Here we are. Okay, again, just briefly looking at the stimulus on the top of here of the, I don't know how to do this. Okay, you can see the finger is being burnt, and it goes through a pathway to the spinal cord, to the brain, and to the hand, and you remove it away. Okay, that's the stimulus of an acute pain. And then here, similarly, on the hand, there was a stimulus, maybe a bee sting or a burn, and you see again how it goes through the spinal cord up to the brain. It's an instantaneous message. But sometimes what happens with chronic pain is that which occurs in like 20% of the population, we get these aches and pains and we can't identify the cause. And when it persists like that, it becomes much more complex. We have to learn how to rewire the body system so we can figure out, how to deal with these chronic pain situations. People don't always remember that they had an injury. People don't always remember that they had even a trauma. It might be buried very deeply in their brain. But what happens is when this pain persists, inflammation is set up everywhere, and it comes into a cycle where it comes and goes, and you don't even know the cause of it after a while. And it becomes very distorted as well. The nervous system can really misinterpret what's going on. So I was thinking about somebody was explaining to me what does fibromyalgia feel like. And she said, hold your arms out for a really long time and pretend like you're holding like 2 milk bottles or something, and hold it and hold it and hold it on the first hour, the second hour, the third hour, kind of like what they do to the soldiers in the army. And your muscles just start to spasm and become weak, and they become fatigued, and they're burning. And she said, I feel like that every day, all day. My muscles feel like that all day, every day. And that is not logical. You can't find the cause of it, and she can't find a way to treat it either, for the most part. These people are trying to use anti-inflammatories and things, and they're not always working. We can also think of a child who has a hypersensitivity to their skins. Some children have what they call tactile defensiveness, and they can't stand the feel of clothing. It's not logical. I had a little girl who wouldn't keep underwear on when she was a little girl. And she said later on, when she was older and could describe, she said, I felt like somebody was rubbing sandpaper on me all the time. And like, what's the logic in that? How do we explain that this little child can't wear a sweater or can't put their shoes and socks on. And at first, it's a whole discussion in itself. How do you deal with children like that? They have a sensory processing disorder, and it hurts the child just to hug them. And adults don't know how to interpret this. They might think it's something like the rejection of the parent until they figure out what's going on. But there's a lot of treatments and a lot of therapies available to these patients and to these parents right now. Another example of a distorted kind of pain is the nature of a phantom pain. Somebody is missing a limb, and yet they're crying out in pain for the pain of that leg that they lost. All right, so some types of chronic pain that we all know all too well: headaches, post-surgical pain, post-trauma pain, lower back pain, cancer pain, arthritis pain, neurogenic pain by nerve damage, and psychogenic pain, that pain that isn't caused by disease, injury, or nerve damage. And again, getting back to fibromyalgia, I remember for many years in the medical field, I would say until the last 5 years, women who especially get fibromyalgia, that's a diffuse inflammation of all their muscles. They're considering an autoimmune disease right now, which all have their basis in high inflammatory states, that almost all immune diseases start that way. Not clearing an infection that went too deep or a virus that went too deep and sets up an inflammatory response, and it can hit anywhere in the body, and it's very, very difficult to treat. But people with fibromyalgia were told that they had an emotional disturbance, and they were told they had a psychiatric problem. They put them on psychiatric medicines for years, and it pains me the word to play on words. It pains me to know that they treated women like that for so long. And men get it too, but it's mostly women that get it. Okay, so if you've ever been sick or injured, you know that pain is not even just from an injury or from a surgery or from cancer, God forbid, or any of these things. Pain can also be psychosocial. You can have, here just wait a minute, one more description of different types of pain. There's clear neuropathic pain, and there's mixed pains, and there's nociceptive pain, which are these are disorders and these are syndromes. And the sports injuries, there's all kinds of things. Painful comes in all forms and sizes. And it causes a cycle that it's really difficult for people to break, because they get depressed, they get anxious with it too. So when you have that physical pain, you become a chronic pain patient. And most people know chronic pain patients are very, they can be very difficult to work with. Why? Because they're in a state of depression, or they're angry because they're just not being helped by anyone, and nothing works for them. So they've turned to sometimes self-medication. Like, they become, abusive to alcohol and other medications. So I know today it's very popular, even in Israel, people are getting what they call medical marijuana, but they're not getting it medically. They're just getting it on the streets. Okay, we'll talk about that. So anyway, there's a cycle of chronic stress that comes with pain, with chronic pain. And if people don't get a handle on it emotionally, it really destroys them and their families. I know there are people who get divorced over it. Okay, so we're talking about psycho-emotional pain, which I want to lead into Hannah's discussion, because she knows very much more about this than me. But what causes this kind of pain, it's not really clear how you can get pain from something that you can't get a physical cause to. Now she had experiences causing her pain, but I know that her mind-body discussion will also include people who have painful memories that transform into physical pain. So anything like deep sorrow, sadness, grief, depression, loneliness, isolation, negative emotions, all those things can definitely transform into a painful state, worthlessness and shame. So this is what we were talking about, these chronic fatigue syndromes and fibromyalgias. These are all inflammatory, and they're all chronic, and they don't know really the causes of them. And we just try to treat them symptomatically. And if you're in traditional Chinese medicine, though, you can get to the root cause, and we can talk about that in a while. So we were just talking about the cycle of changes your social behavior, it changes your psychological makeup. You don't want to relate. You can't relate to people anymore. Nobody knows what you're going through. So we talk about all these stresses. They can be real stresses like accidents or health conditions, but a lot of times it's very emotional stuff that happens in your family, unresolved painful memories, post-traumatic stress disorder, social isolation that we're seeing a lot of now because of COVID, rejection, discrimination, worry, anticipation of pain, so many things, rage, panic, shame. All these things can transmit and transform into actual physical pain almost anywhere in the body. You can feel tingling, numbness, burning, irritable bowel, digestive stuff, bladder stuff, palpitations, headaches, migraines, and way, way more. This is how emotional pain can help can turn into physical pain, not help you. But So anyways, this causes a lot of emotional disruption to people. There are programs out there that people go to all over the world that will help you process the emotional pain and physical pain, because the body actually experiences it exactly the same way. There is no, in the brain, there's no difference between emotional pain and physical pain. They're one and the same. So how do we deal with these chronic problems that no one else can fix? So we know that in Western medicine, which I was very much part of, so the cycle of pain again causes all kinds of disruption in every part of your body. Western medical treatments. Okay, how do we get rid of pain? Okay, and I was part of this for many, many years, but now, of course, I'm in combining and doing integrative approach to medicine. I'm looking at the Western model and trying to incorporate that into the Eastern model, because I think that's more appropriate to do in most situations. But here we're going to talk about medications in a minute, but we have electrical stimulation is one way to get rid of like back pain and nerve pains of people who have neuropathies of their feet and their fingers and their head. They just actually zap out the nerves with electrical shocks. Doesn't sound too pleasant. Nerve block, that's something that I would do in anesthesia. I would take an injection of lidocaine or novocaine like they do at the dentist, and we would just inject the area and just block the area. My parents have had multiple experiences with having what they call nerve block in their back for hip pain and for foot pain and all kinds of things. And it's very painful injection. Goes in your back or goes in your leg or your knee or wherever it needs to go. And it also with maybe a steroid to help be anti-inflammatory. And it really hurts, and it doesn't last. It just doesn't last. Now we have surgeries that correct injuries. That sometimes is very successful. It can sometimes contribute to pain. And we can also offer people rigorous and uncomfortable and lengthy occupational and physical therapy sessions to retrain the nervous system to respond normally to sensory experiences. And then there's intensive psychotherapy. So this is what the medical people do, along with medications. Medications are available. Okay, but what medications are we talking about? We're talking about over-the-counter pain relievers, Tylenol, non-steroidal anti-inflammatories, which we know are very dangerous they're good for anti-inflammatory, but they're dangerous to the digestive system, and people have had a lot of problems. They're a little bit of blood thinner, so that people get blood clots. Aspirin, same thing. And they set up an inflammatory cycle that you can't get out of too. Then there's the opioids. Opioids are the biggest opioid problem in America right now. It's killing many, many people. Pain relievers, people are getting addicted to morphine, to codeine, to hydrocodone, to all kinds of different things. They're analgesics too, but they're antidepressants, anticonvulsants. There isn't any medication that hasn't been tried to help with pain. Anti-anxiety, like I said before, people actually do need anti-anxiety medications. By the time they're so ignored by people, or they've been passed around, been to multiple physicians and multiple healers, and they haven't gotten any relief. So yeah, of course you're going to be depressed and anxious, and then you may actually need those anti-anxiety medications, including like the Valiums and the Xanaxes and all that stuff. So I don't know; these don't look like really ideal to me, but they have their place. Okay, I just want to tell you that putting the Western and Eastern model together, this is appropriate for some people, but I wouldn't give it across the board. And I'm really ashamed that the medical community didn't look further into other alternative therapies, which I'm going to just mention briefly because we want to get to Chana. So traditional Chinese medicine is what I'm practicing now, along with looking at the medical model. But we don't just treat the problem; we treat the whole system. We evaluate and we try to correct your sleep, your nutrition, your current medical problems. We try to address the stress in your life and the previous traumas, and then evaluate the pain. What does the Chinese say that applies in every generation? Pain is a warning signal, and if you ignore it, this warning, you'll expect much more serious consequences. And so instead of taking a narcotic to just deaden the pain, let's say, we want to try to encourage people to get to the root cause of the pain, even if it's one of those types that are very difficult to find the cause. And that's where the mind-body comes in. That's where Chana will discuss. I happen to give acupuncture, and I'm a big believer in herbal medicine, acupuncture, and all the other modalities like Tai Chi, Qigong, meditation, massage, craniosacral, exercise, physical therapy, good nutrition. We want to clear these blockages that are causing the pain and help relieve the pain. And there's all kinds of wonderful therapy. There's music therapy, art therapy, and medical cannabis is out there now, and it's also CBD oil. I just want to say something about acupuncture because it's really important to know. If I can find it. Acupuncture. Oh, yeah. I just looked this up last night just to give it a little more credibility because some people still question. It is a branch of the Chinese medicine system for thousands of years. However, it works very, very well alongside of Western medicine. And I repeat this over and over. If you know enough about Eastern medicine and Western medicine, if you know enough about either one and both of them, there are no contradictions. They work so, so well together. Okay, so what we do is we apply needles or heat or pressure to different points in the body. And this is the theory that it blocks any kind of blockages of whether it's nervous system flow or blood flow or lymphatic flow. Something's blocked, and that's causing the pain. So we try to release the blockage. And how does it work? So the National Institutes of Health did a big study, or a number of studies actually, and they said acupuncture works particularly well on chronic pain, like back pain, neck pain, and you need several treatments. It's not an overnight thing, but and migraines and all kinds of pain. But it says it's a reasonable option. This is what they're calling it. And how does it actually work? It stimulates the body and it promotes the healing by normalizing and harmonizing the endorphins in your body, your pain sensors and your endorphins. And disrupts the blockage of the blood flow. If there is a blocked blood flow or blocked nervous system flow, it unblocks the blockages as well. So it does a physical thing. It's not just woo-woo energy channels. It is that, but it's also so much more. And I want to say just a bit about medical marijuana. It's increasingly popular. It does ease certain types of pain. It doesn't really get to the root cause either, but it does ease the pain from nerve damage and inflammation greatly. So let me go on to the next here and see. Okay, this is my acupuncture slide. You should give me a call. I will give you an acupuncture treatment, explain way more what I can do for you. So now, without further ado, we're going to introduce our guest. I'm going to bring her on so everybody can see her, Chana Studley. And let's take this off the sharing mode. We're going to interview Chana right now. Hi, Chana. I'm going to give your bio here. Oh, I have the wrong paper here. So sorry. Chana bio. I know it's here. Okay, great. Okay, Chana. Hello, Chana, who lives in Jerusalem. How are you?
Hi, nice to meet you.
Good. Okay. Chana is an educator. She is she's recovered from severe PTSD and injuries after 3 separate violent attacks.
Oh my goodness! Nice to see you.
80s. Sorry. Okay, I'm going to read the bio, and then maybe your internet will come back. She trained as a counselor in Manchester, England, in the Women's Crisis Center, and has been working with people in all areas of mental health for 30 years. Chana is a certified life coach and a 3 Principles Practitioner. She will explain to us what that is. She is also a proud member of United Hatzalah Psychotrauma and Crisis Unit, and a world. You don't have your phone on, do you, Chana? Because there's an echo. There wasn't an echo before when we tested. Okay. All right. So conducted 5 successful case studies into pain relief, and her research was presented to a 3 PUK conference in London.
Should I switch you up?
Yeah, turn the phone off. Right. That'd be great. She's turned to a new program in helping people all over the world with chronic pain and other physical illnesses to heal by understanding the mind-body connection. Chana has also had a very successful career in Hollywood. Oh, I will have to hear about that too. She has published 2 books. She explained to me yesterday that she likes to write novels about people who have pain because they're she'll explain why she does that. Sounds very interesting. She explains her healing methods and the way to deal with chronic pain with the mind-body connection. And her first novel is called Painless, a novel about chronic pain. And you have a second one coming up, which you'll tell us about. And without further ado, welcome, Chana. Hi there. Are you there? Can you hear me? Okay. Chana, can you hear me? Can you hear me?
Hi. I'm not sure if you can hear me.
I can. Yes, we can hear you.
I can hear you, but I don't know that you can hear me.
I can hear you.
Mm-hmm.
I hear you. I do. I hear you. Something went. Okay. Chana, you can speak. Just tell us about your journey. I can hear you. Okay. I think we got a little stuck here. Oh, technical stuff. I love technical stuff. Hold the phone. Let's get Chana on the WhatsApp. Okay. Chana, what's talking, everybody? So sorry. I hear her fine. Chana, can you hear me? Okay. Oh, shame. What's going on here? Well, okay. My microphone is on. My microphone is on. My microphone
I
is
can
working.
only hear you through Facebook.
I think you
Yes,
should
but
turn
only
Facebook
through
off.
Facebook, not on the site.
Okay, I don't really understand that because you're not muted. Let's try again. I'll take you off and I'll put you back on. Okay, I have your microphone on, Hannah. You're not muted. Okay, so how are we going to do this? Let's see. Having issues. Yes, I am. Okay. Well, Hannah, why don't you just go ahead and speak because we can hear you. Okay. Go ahead and
I
speak.
know
Tell
I'm
us your
not
story.
muted on my end either. Can you? You can't hear me.
I can hear you. I hear you. I do hear you. Oh boy. We checked this earlier. It was just fine. I don't understand. Okay, you can speak. You can speak. Just go ahead and speak. We can hear you. Hannah, speak.
Yes, but there's a
I can hear
delay.
you. I can hear. Okay, doesn't matter. Just tell us your story because it'll be recorded too. Can you speak? Yeah. There's not. I can't troubleshoot what's happening. I'm sorry. I don't think it's from my end because everything's working here. Why don't you? Do you want to just speak, Hannah? I hear you. I hear you. Okay, you. Okay. Look at your phone. Okay, and I'm going to do WhatsApp. Okay, everybody, we're having a very bad technical problem. I think we're going to have to maybe reschedule. I'm not sure what's happening here. I'm going to take Hannah out of the stream, and I'm going to see what's happening here. I'm going to add to the stream. She took herself off now. Hannah, where'd you go? Okay, sorry everybody. Let's just maybe we'll have to reschedule this. Hello, are you there, Hannah? She's missing completely. I think she cut herself off. Okay. She said she's not technical. I'm not technical either. And it was working. We did check things, people. I'm very sorry. We cover a call and we'll just give this one more try. And then we'll try to call her and see what happened. Hi, Hannah. I want to hear her story so much. I think she has her phone off. Okay. Jeez, I'm so sorry, everybody. Not answering. Okay. She's gone completely. Hannah? Hi, you took yourself off? I understand. Okay, so re-sign in one more time and try that one more time. Okay? Click that link one more time that I sent you on the email and try to re-enter. You can close Facebook because then it won't be an echo. You don't need it on. You don't need it on at all. We're not going through Facebook. It's just broadcasting on Facebook. So there you are. I'll lead you to the stream.
Okay.
Okay. You hear me?
See, it's not coming. But I can't hear through the computer.
You can't hear anything I'm saying? You can't hear anything I'm saying? Okay, well, everything here is working, so I don't know what to do. I'm so sorry. We're going to have to reschedule this, I guess. Oh, you went off again. Okay. All right, everybody. Well, I think that Hannah's going to have to come back another time because we really want to hear her story. I'm so disappointed, and I'm sorry that we're having technical issues. So if I could just have your patience and just know that we will bring Hannah back another time. We will end the broadcast now and wish everybody a very healthy week.